The big piece here. This is unfortunately the whole weight-bearing surface here. You're going to end up with a big crater here. Give me the shaver first thing. Hold this. Now we're just going to trim around the edges here, get all this loose fragmented stuff off of here. And now here's the problem. The MRI said there was fragmentation on the outside of this defect, which there certainly is, and we just cleaned that up. But unfortunately, where the MRI was wrong, and I can drop this probe right in here, and I want you to see this. This whole joint surface here, you can see me move this. This is totally undermined and detached. If I push here, it's basically the entire weight-bearing surface of what you would walk on. And to remove that is going to leave a huge hole here on the end of your bone. And then you would need cartilage transplantation surgery, and I'd have to send you downtown for that. But there is a technique whereby we can open your knee. Obviously, we can't do that now, as we didn't talk about this. This was not expected. And we can drill out the base of this thing and use some bioabsorbable fixation, probably 4 little bioabsorbable screws that countersink this cartilage tissue into a raw bony bed underneath. This is much bigger than it shows on X-ray. It's much more extensive. And as opposed to the MRI saying fragmentation on the surface, but the base of this does not appear detached, it is in fact detached. So I'm going to stop this procedure right now. We're going to need to do more here. And unfortunately, this is going to take another pair of skilled hands. And I believe we're going to probably have to, we may be able to do it arthroscopically, but because it's so big, I think we may have to actually open the knee so that we can get behind here, burr this down, and perhaps even put a little bit of bone graft material, because I feel a real huge crater back there. So I do not want to remove this, even though it's loose, because we'll be left with a real problem here. There's your lateral side. That's how it should look, nice and smooth. Cartilage, meniscus is fine. Cruciate ligaments are fine. Back of your kneecap's fine. Femur there is fine. That's under your kneecap. But this is what you're walking on the inner side of your knee right here. and it's much bigger than X-ray shows, much bigger than MRI shows, and I really think that we should make every attempt to save the native cartilage tissue there as opposed to getting into transplantation surgery. And I do think because of the extensive area involved, we're going to have to open your knee and fix that and have you non-weight bearing for 6 to 8 weeks, so it's going to become a much more complicated procedure.